In this video, we're going to look at spinal nerves, see what they're made of, and how to count them. Just to remind you, a spinal nerve is a convergence, a blending together of fibers from the dorsal root and the ventral root. And then if we zoom way in, we can see that it actually has quite a similar structure to the way that muscle fibers are bundled within a muscle belly. You might remember the epimysium and perimysium and endomysium. Very similar arrangement here. Epineurium is the name that we give the delicate connective tissue sheath that wraps the whole nerve. So this whole spinal nerve, say C7 spinal nerve, is wrapped in epineurium. The pia mater would then be on top of that. Although there may be a little bit of areolar and adipose tissue within a nerve, nerves are mostly made of bundles of axons. The bundles of axons are called fascicles, very much like the nomenclature we had learned again in muscular anatomy. Each of those fascicles is wrapped in perineurium, and each of the individual neurons is wrapped in endoneurium. Some of them are myelinated, that would be underneath the epineurium. Endoneurium would be surrounding that Schwann cell and the myelin that we see here. So as it relates to this chapter, the most important concept is that a spinal nerve is a mixed nerve carrying both sensory and motor fibers. So we have 31 pairs of spinal nerves, 8 pairs of cervical spinal nerves, 12 pairs of thoracic, 5 lumbar, 5 sacral, and then some coccygeal nerves down below. Now, this idea of having C8 might sound strange because you spent so much time memorizing that there are 7 cervical vertebrae. That's true, but it's also true that there are 8 pairs of cervical spinal nerves. So how can that be possible? Look closer. You can see here, C1 spinal nerve, a pair, right and left. That pair exits above the atlas, the C1 vertebra. Then C2 spinal nerve exits below C2 and so forth, all the way down until we hit C8. C8 is exiting between C7 and T1. And then the T1 spinal nerve pair exits below the first thoracic segment. So for the first 7 spinal nerves exit above the vertebrae for which they are named. C8 is the outlier. It exits between C7 and T1. And then the T1 spinal nerve and everything below exits below the vertebra for which they are named. Now, how did they actually get out through the cord? You might just go back to review skeletal anatomy really quickly and just remind yourself that there are lateral foramina just below the inferior articular facets that make small holes on the side of that mobile segment, which allows the spinal nerves to exit. Here we see our cauda equina, and we're on to the next slide. Dermatomes. Dermatomes used to be really important back before we had CTs and MRIs. If we were trying to figure out which spinal nerves may have been impinged or injured in trauma or cancer, they're still interesting to look at. Basically, this just tells us what the real estate of the skin, which is innervated by any given segment. So, carry sensory information from a large part of the scalp, C3 on the neck, C4, etc., C5, 6, 7, 8, and T1, making up most of the innervation of the arms. And then you see the thoracic segments, lumbar, sacral, and coccygeal sections. So when you're dealing with trauma or neuropathy, sometimes dermatomes are really helpful. But like I said, now we don't have to rely just on dermatomes and where patients may be having numbness or tingling. We can order up a CT or an MRI and actually look right at the actual nerve and spinal cord. When you spend time in your lab mode learning the anatomy of the cross-section of the cord, you're going to come across a lot of these terms as well. And in the longitudinal model, the plexus and ramus. So let me teach this a little more information in that lab video. The previous slides we were looking at kind of chopped off this additional information right about here, right? We know about the dorsal and the ventral roots, the dorsal root ganglion and the spinal nerve. But the spinal nerves, just as they traverse those foramina and head out, they actually split. The spinal nerve has a dorsal ramus. The word ramus means branch, and this would come around to innervate muscles of the erector spinae group, posterior skin, and the erector pili muscles there within the skin on the back. But the much larger ventral ramus comes around, in this case looking like it's a thoracic segment, in between the ribs as an intercostal nerve, and then those are providing both motor information to those breathing muscles and sensation coming in from the breast or the axilla side of the body. In chapter 16, we learn all about the autonomic nervous system. Remember, the autonomic nervous system refers to the visceral motor division, involuntary motor signals coming down from the cord and out to blood vessels and organs. Have these special little sympathetic chain ganglia and some parasympathetic ganglia that we'll be talking about in that chapter as well. On the next slide, right here, we see a good visual on what a plexus is. Now, I wouldn't worry too much about this picture. I know it can be really daunting to learn your roots and branches and trunks and all of that. It's actually a little bit beyond the scope of practice, scope of this course rather. All I would like you guys to know is that a plexus is a merging and splitting and recombining of the neural tracts within the neck. The cervical plexus has contributions of C1 through C4, and you can see some of the interesting things that it does. This is probably one of the most essential, the phrenic nerve, which goes to the diaphragm. The brachial plexus gets its name from the arm, brachium as in arm, and you can see C5 down to T1. These are the spinal nerves, and then trunks shown in blue, the anterior and posterior divisions, and then the cords in major branches. So for this course, we don't have to worry about memorizing all of this information, but I would like you just to have an idea of where these things go. Axillary nerve, as you may know, goes down underneath the arm. Radial and ulnar and median nerves are also some of the most important nerves of the arm. In your future peripheral neurology class, if you're going into physical therapy or into medicine, you're going to learn and memorize all of that to a higher level. Here we get to connect the dots here. We're learning muscles, and we can also see which branches of the brachial plexus helps to innervate these important muscles that we've been learning in lab. Really good clinical information. Lumbar and sacral plexus, you can see here, involve L1 down through L4 for the lumbar plexus, and then the sacral plexus merging and splitting of L4 all the way down to S4. That's it for this video. Next, you should watch the videos on the tract and motor pathways as well as reflex.